Good morning, ladies and gentlemen. My name is Ansh, and today I have with me in the room a great team from TechInvention Lifecare Private Limited. We have with us Mr. Sanket Shah, Mr. Sarang Pathak, and Mrs. Shaily Sethi. Okay, ma'am. So, ma'am, what is the leading cause of public health crisis today?
As per the review article published in Lancet, titled The Global Burden of Bacterial Antimicrobial Resistance in 2019, a systemic analysis, it states that by 250, 10 million people will die of antimicrobial resistance every year. So you can imagine the gravity of the problem AMR will be having in the front of world.
Yeah, that sounds like a big number.
Yeah,
In
and
fact,
it is 10 million people per year.
Per
so
year.
The gravity is very huge, and the threat, this will be the biggest threat of the 21st century.
It's very surprising that me and we as laymen haven't heard of it. So, could you tell us a little more about what antimicrobial resistance is, ma'am?
Antimicrobial resistance is the resistance which is posed by the microbes. The microbes can be virus, bacteria, fungi, or a parasite. And this resistance is posed to the antibiotic with which we treat the infections. Now, if you see, the irony here is that the drug which was already effective on these microbes now becomes ineffective. So the common problems which we face, or you can say the common infections which we have now, like respiratory infections, wounds, even the skin infections, they will all become severe infections, and then it will lead to death because of AMR. So even the simple infections become incurable.
Right. So, ma'am, because of the resistance that these microbes have developed, they now become sort of like superbugs.
Yes.
So, ma'am, do we have some regulations in place or being considered in how to tackle this antimicrobial resistance at a higher level?
Yeah, so in the common day-to-day practice, you must have seen that everyone is having a habit of popping the antibiotics. We pop the antibiotics without knowing the reason, which if it's needed or not. So I'm suppose we all do that.
Right.
Even if it's not needed, we just take the antibiotics, even we don't consult the doctor also. So in fact, further, if you see how the antibiotic use is going on, they are even given to animals. They are sprayed on the crops. And there is an anthropogenic use where the effluents are going into the rivers from the plants. So there is an environmental impact also. So it's not that this AMR problem is focused just on the humans. It is covering animals and environment. So if we want to have effective regulations in this, then we have to encompass the concept of One Health, where we will cover animals, humans, and environment, all three of them.
Right. Now, if we're talking about this large ecosystem where we need to take care of something more than just humans, and you mentioned that animals are also affected by antimicrobial resistance. Could you tell us some more about how animals are?
Yes, it's a very serious and a neglected issue. Farm animals are used by millions of people across the globe, both as a source of living and as a source of nutrition. Now, just like the way antimicrobials are used irresponsibly in humans, the situation is same even in animals. Well, in animals, we are using antimicrobials for preventing infections, treating infections, and as growth promoters. Now, this is a practice which is followed extensively in low and middle income countries. But in high income countries, the use of antimicrobials as growth promoters is strictly banned, and they are only used for treating sick animals, that too with a proper prescription from a veterinary doctor. Now, the irresponsible and the rampant use of antibiotics has led to the bacterial pathogens which are present in the animals to develop resistance. Now, there are numerous studies which are published which show that these bacterial pathogens are not just resistant to one class of antibiotics, but multiple classes. And all these classes of antibiotics are actually licensed for human use. These deadly strains of bacteria can easily be transmitted from animals to humans through consumption of contaminated food, water, or humans directly coming in touch with the secretions or the excretory products. In many ways, AMR is a zoonotic threat. Zoonosis means when the pathogens are transmitted from animals to humans. Now, when these deadly bacteria get an entry inside the human body, the devastation is just beyond our imagination. these deadly pathogens are often feared by the experts from the global scientific community because they have tremendous potential to cause a deadly outbreak, or say for that matter, even a pandemic. In fact, 60% of all the infectious diseases which occur in human beings, the pathogens which are responsible behind them, they are coming from animals. If you see SARS-CoV-1 outbreak in 2003-2004, swine flu 2009, MERS 2012, Ebola 2013, and most recently the COVID-19 pandemic, all these outbreaks were caused by pathogens which jumped from animals to humans. And needless to say, when these outbreaks or pandemics happen, the damage that is inflicted to human lives, the economy of the country, and the healthcare systems, it is just beyond our imagination. We saw it during the COVID-19 pandemic. It was a glaring example.
Yeah.
So coming back to your original question, yes, the AMR issue in animals is a looming threat, and it warrants urgent attention. And if we adopt a sloppy attitude towards this issue, then trust me, we already have sown the seeds of the next pandemic. It is just a matter of time.
Sir, we have just realized that AMR and zoonosis together are such a big issue. So how can we go about tackling AMR and zoonosis?
Well, both AMR and zoonosis are like complex and challenging issues, and they are not just confined to a particular territory or a particular geography. Now, these issues arise when there is a very close interaction between humans, animals, and their shared environment. Now, factors like pollution, climate change, deforestation, trade, tourism, travel, concept of companion animals, and migration of animals to new territories have played a crucial role in giving rise to AMR and zoonosis. And addressing them purely from human, animal, or the environmental perspective is not going to solve the problem. These issues need to be handled holistically. So taking the One Health approach is the plausible solution to combat these perilous threats. Now, the concept of One Health is not something new. It's a 200-year-old concept. Earlier it was one medicine, then it was one world, one health, and now it is One Health. And this concept has gained a lot of momentum in the last couple of years because of the periodic outbreaks of infectious diseases that we have witnessed, along with the rising threat of AMR. One Health recognizes that the health of animals, humans, and the environment are all interconnected. There is no one standard definition of One Health. Different organizations across the globe have defined it in different ways. So it is a collaborative and multi-sectorial approach at the local, regional, national, and the global levels to ensure the well-being of animals, humans, and the environment. Under the umbrella of One Health, we have like different professionals like epidemiologists, public health experts, ecologists, environmental scientists, animal and human healthcare professionals. So these professionals work in close collaborations with each other to study these complex interactions happening between animals, humans, and the environment. And based on their observations, they come up with robust strategies to ensure their well-being. So in simple language, if I have to summarize what is One Health, it is healthy humans, healthy animals, and healthy environment.
That sounds like such a beautiful concept. So how do we do this, sir? How do we go on to achieve One Health?
Well, strengthening the surveillance of diseases and their outbreaks, collaboration between the three sectors, animals, humans, and the environment, public awareness, which is lacking. Well, people don't know what is One Health. Research and development, and say like every country should have its own national One Health policies, strategies, and plans in place, and they should be religiously implemented. Under research and development, vaccines can play a very crucial role in achieving the goal of One Health. Well, both these looming threats, that is AMR and zoonosis, can be effectively mitigated through vaccination.
Right.
Now, vaccines have prevented almost like 50 million deaths in the past 2 to 3 decades, that too in low and middle income countries. So when it comes to zoonosis, vaccines when given in animals can prevent the transmission of pathogens from animals to human beings and at the same time from animals to animals. Now, the best example is the rabies vaccination campaign for domestic animals and wildlife in high-income countries. This vaccination campaigns have completely eliminated the threat of human rabies in these countries. Well, on the other hand, in developing countries, the threat is very much prevalent because these countries unfortunately do not have the resources to implement these campaigns. Now, when it comes to AMR, vaccines can prevent the emergence and the spread of AMR both directly and indirectly. So when I say directly, it is through preventing the emergence and the circulation of antibiotic resistant strains. And at the same time, vaccines can also reduce the inappropriate consumption of antibiotics. When I say indirectly, it is through preventing viral infections. Now, in many instances, vaccines have led to the complete eradication of pathogen. The best example I can give you is the smallpox. It has been eradicated globally. India, on the other hand, has completely eradicated polio from its soil.
Right.
Polio vaccines have played a very crucial role in converting India from a polio endemic country to a polio-free country.
Right. Okay. So, sir, Sarang, sir, what is TechInvention doing to achieve this concept of One Health?
Well, Ansh, I would take you to the streets of Mumbai, which have been completely decorated with the posters of G20. And there's a very beautiful message on every poster, and that message is one world, one family, one future. So we need to come out of the mentality of, that the problems of animals are different than those of humans. So now world has realized, and as Shaily and Sanket elaborated, that these are all interlinked, well connected. And the issue with one system inevitably becomes the issue of the other system. So we at TechInvention realized this right from the inception, and we were focused on kind of working on a model which would try to address the issues of every system, but in a coherent manner. So at TechInvention, we are doing research and development, not only for the veterinary segment, but also for human segment, and from two perspectives. So one is the prevention part, the other is treatment part. And essentially here what we are focusing on is the biologics. So synthetic drugs is one aspect which goes into treatment, and we are doing the biological part, the biologics, which goes as a preventive mode of, addressing the issues of infectious diseases. So if I may split, there are two diseases broadly, infectious diseases and non-infectious diseases. Whereas the ecosystem is now very well equipped. The research and development has been inclined towards non-infectious diseases like diabetes, cancer, so on. We are focusing on infectious diseases. So we are working on monoclonal antibodies which would work against infectious diseases. We are working on some conventional as well as novel vaccines which would be used for animals, which would be used for humans. We are also working on biological products that can be used to tackle the issue of antimicrobial resistance. So in terms of research and development, we are working at all these fronts. We are also working on diagnostics because that's an essential part. If I take you to 2020, you will realize that there was so much of hustle everywhere. Masks, PPE kits, vaccines, and so on, So there was a lot of chaos and commotion everywhere. And that was essentially because we had lack of diagnostics, So even the WHO gave a message to the entire world that it's testing. So do the testing first. Yeah.
So, sir, could you elaborate a little about on capacity building and how should low and middle income countries go about it?
Very interesting, Ansh. If you see, broadly, we have around 200 countries on the planet. Of the 200 countries, very surprisingly, when we were attacked by this pandemic, we had only a handful of countries having the resources to face this problem. See, for example, in the whole of world, we only had few countries from the western side and a couple of countries from Asia who had the capability of manufacturing vaccines. So that was a glaring issue. And what at TechInvention we do is we have identified a set of countries who, if guided properly, the countries, if given right direction, can put in the resources together to address the issue of capacities. They can as well complement the efforts that have been put in by few of the countries from the West and few countries from Asia, and they can collaborate and develop capacities, build capacities. For example, not many countries have the manufacturing facilities for vaccines. They're absolutely dependent on few countries, to supply them. So if, say, God forbid, we are stuck with another pandemic, they will again be looking, to these countries to supply them the vaccines.
Right.
And on the contrary, if you see, these countries have the resources. They have funds, they have some of the resources with them. It's just a matter of guiding them and putting these resources together. So in TechInvention, we have targeted this set of countries wherein we advise them, we consult them, we ensure that they get proper funding, we ensure that they get proper regulatory support, because vaccine manufacturing is too complex.
Right.
It's highly regulated and it's technology driven, and that technology is a deep tech, you know. So we are enabling these countries to have access to all these resources, understand them, put them in order that they would be capable of producing, manufacturing the vaccines by themselves. So this is the effort that TechInvention is currently pursuing.
Okay. So based on our conversation so far, if there was one message each of you could give the audience, one simple short message, what would it be? Shaily ma'am.
Judicious, careful, and rational use of antibiotics should be promoted.
Absolutely. Sarang sir.
Ansh, I would go by the dictum that we learned in our school days, you know, and that is prevention is better than cure. So we should do everything to equip ourselves with necessary tools to prevent the diseases.
Right. It shouldn't just happen in the first place.
Yes.
The best. Yes, sir.
Well, animal health cannot be neglected. Well, if we neglect this issue, brace yourself for the next pandemic.
Ladies and gentlemen, my takeaway and my learning from this conversation is that we as humans need to come out of the mindset that we are separate from Earth and all the other species. We need to embrace the fact that we are a part of this environment, and we need to take care of ourselves and our planet and the species around us. Because ultimately, the challenges they face, the diseases that happen to them, do affect us.
Exactly.
Thank you for your time, guys, and I look forward to having you back here again.
Thanks,
Thank
Ansh.
you.
Thank you.
Thank you.